Kimberly, as soon as they kick our friend out, which they did, I am going to let you take over. You know, if you've been listening, that I listen. I don't go off and do something and come back and go, that was great. Let's go to the next one. I listen. So sometimes I'll have questions about this, or sometimes you'll spark something like Kimberly, Sharon did, and I'll go off on a tangent. So be prepared. I'm going to start the
Awesome.
timer, and I'm going to leave. So, but it's all you, and I'll be in the background if you need me. But I'm going to let you be the face.
Excellent. Thank you, Stephen. Living, caring, grateful for sharing. Boy, oh boy, I love to work with the daring, turning confusion into clarity, helping patients to thrive, showing the world that pharmacists change lives. More than counting pills, we dispense purpose and pride. PharmaCare Solution is where true care resides. Hello, everyone. I'm Dr. Kimberly White, and I became the go to pharmacist in my family, along with over years and years of experience. So I'm excited to be here. Thank you for having me. Stephen, would you like
Yeah,
for me to just talk to the group?
yeah. This is more of a TED Talk format. I can interview if you want. I'm good at it, but I would rather you, unless you want me to. But this is all about you. This is not anything to do with me. So I'm not going to do any fillers, and that I'm just going to be asking
Okay.
questions. So if you know what you want to say, just let me get out of here and you do it.
I shall. Well, wonderful.
All
Thank you
right.
so much. And I really am thrilled to be here. I was just, when I met Dr. Smiley at the Military Influencer Conference, I was elated. I mean, we talked, he was, when I met him, I felt like I've never met a stranger. He was wonderful and just instilling so much inspiration to people. And in the group, we all laughed and enjoyed one another as if we had known each other for a very long time. So I'm very excited to be here and honored, honestly, to share my story. So I'm going to go ahead and get started. I became the go-to pharmacist in my family a long time before I had a company. So that is very clear. I shared that before, but anytime in my family or my friends they needed to understand a prescription, I chose for them over-the-counter medicines. I went through and sorted through piles of supplements. They would just call me for my advice. And then for me, when my father faced several health challenges, he was overwhelmed by a long, long medication list, and no one slowed down to explain. Not even the pharmacist at the pharmacy counter, not the rush visit with his doctor. But when the two of us sat down, I translated the science, I light up his doses, we put all his meds in a medication pack and a tray so that he can stay organized. You know, his fear slowly dissipated. So as he and I mean, I could see his whole demeanor was really very nervous. And as we smiled at each other and came through this together, that fear turned into understanding. So that was the aha moment for me. And that's when I was able to exhale and birth my company, PharmaCare Solutions. So, just by background, I'm a pharmacist. I have an undergraduate pharmacy degree from Drake University in Des Moines, Iowa. I also have a doctor of pharmacy from University of Florida and a ton of years educating physicians, launching drugs, supporting research, doing a lot of work just to integrate education with some of the sharpest minds in healthcare with just the perpetuation of science. Just there's so many developments, there's things that we've learned over the years with medications, improving them. At first there was a lot of tablets, but now we're well into biologic therapy. So a lot of that evolution was inspiring to me, but To be honest, I was grateful for those years, but my first true love is talking to patients. So I love, love, love to help people understand what's going on in their bodies and what medications actually, how they work, when to take it, what are the nuances. And they can make informed choices with their clinicians. So that is where my company began. And I have to tell you how thrilled this is. It's thrilling to help people really understand that medications can be confusing. When you talk about prescriptions or over-the-counter medicines or even supplements, there's a lot to them in terms of absorption and distribution and metabolism and excretion in the body. And certainly, if you haven't done as much as my years and years of training in pharmacology and pharmacokinetics and classes of drugs, then it can be really confusing. And I trust that pharmacists are a go-to reference rather than chat gpt. So for me, I've done a lot of jobs and worked, and my residency was as association manager, but it's truly a blessing to work with patients.
Okay, I'm going to cut you because I got to know something. Okay, you're giving
Yeah.
us facts, and that tells me that you're definitely high on the list of what you know. But stories sell, facts tell. So tell us a story of what you did that made somebody smile. You know what I'm saying? You know what I'm saying?
Oh, absolutely, absolutely. This was actually a recent, this is a recent story. So a patient of mine had surgery, and really she told them about her allergies, and they missed it. The nurse said, "Well, typically if you have this sort of allergy, you can still kind of find something within the class." Well, that's not true. And she actually had a reaction. Her whole entire body broke out in a rash. And we just happened to talk. She called and she was telling me, "Yeah, I'm feeling better because I just wanted to check on her." And she said, "My pain is still there, but I have this rash on my body." And I'm like, "Your rash?" And then we talked through it, and then she told me, and I immediately said, "That is within the same class of drugs as a cross reaction within that class of drugs." And I'm so happy we spoke because she stopped the medication, called her physician, and they prescribed something else, which really did help her. But it took about 2 or 3 days for her rash to clear up, but she was itching. And there was some, it didn't look as sightly as she wanted it to. So that was a tangible example. Or just when you help someone have an aha moment that they're taking the same medications or they're taking something for pain, Tylenol or Motrin. They're both for pain, but it's really overkill on kidneys and liver. So I try to help people understand how things work and really ascertain what are their true signs and symptoms so we can treat the symptoms and do the least amount of harm to them.
All right, so better. But I want a story, and it's now we're down to the crunch time. You've got a minute and a half. I want to hear why you did something, and somebody across the counter or at the window gave a big smile and a thank you, and you maybe saved a life, or didn't, or saved. Give me something like that. I just got to hear it because I know you got tons of them.
Oh, I do. I do. I have a ton of stories. I recently spoke to a pregnant patient, or I shouldn't say patient, they're not patients, pregnant person. And she was just scared about all of the Tylenol information that's in the news regarding whether or not it causes autism. But she's starting to get a fever. So when I told her, "Listen, you're at you," so we kind of triaged with her nurse and physician, and they felt comfortable to get that for her. So I walked her through absolutely everything, the dose, when to take it, etc. And when I tell you she was just so excited that we had that one-on-one conversation because that's what my company does. We do one-on-one consultations just so they can make sure that everyone understands.
See,
So
now
when she
that's what I'm
smiled
talking
at
about.
she
That's what
flashed
I'm
that
talking
winning
about. So we're going to
smile.
have you on again, and next
Yeah.
time I don't want to hear anything about pharmacy except these cool stories. As a matter of fact,
Okay.
I'm going to give you a hint. Just if you type it out or get on a recorder, tell the stories, send it to rev.com. It'll get it out. Do the computer version. Don't do the manual version. And you've got a book.
Oh,
How to Make You
nice.
Smile by by a pharmacist's point of view. Something that's not a bad that's a bad title, but you know what I'm saying. Leland's laughing at me, but Leland can laugh at me. I'm gonna have to let you go because Leland is before I guess we'll catch you later though. But good job. Now you got it at the end. We're gonna get you back and get even more of these cool stories. I promise you that.
Fantastic. Thank you for having me.
Right on.
Bye.
Thank you.